Welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. Now, today's topic, we have we stream on the two Facebook page. One is my clinic page, Center of Balance. The other one is in my acupuncture page. Now, today we're gonna talk about how to diagnose arthritis. Now, the two more common arthritis, hi Judith, and Instagram. One of them is rheumatoid arthritis. The other one is osteoarthritis. And how do we actually diagnose it? Just say hello to you. Okay. We talk about the symptoms. We talk about what is arthritis, and we been talking about the last few days about what causes arthritis from according to Chinese medicine and Western medicines. Now today we're going to talk about how to diagnose this. Judith, good evening. Yeah, good morning for me, good evening for you. That's great. All right. Now, so if you are on this live video right now, please give me a thumbs up. Then share this video. If you're on Facebook or on Instagram, please share this video as well. As if you're on Facebook, please tag your friends, your family, whoever need to know about arthritis. You know, think about who suffer from arthritis in your family. Are there any person, any of your family or friends suffer from arthritis? Now, it's important for them to know this information. We're going to do live video every day. We're going to focus on arthritis in this week. Tomorrow we're going to talk about what is the treatment. What are the treatments available for arthritis apart from Western medicines like drugs, and what can you do at home for acupressure point, right? Now I have few camera in here, so I have to look different one side or the others. Okay. So yeah, say hello to me when you up in this video, this live video. Okay, let's get started. So, of course, going to your practitioner, like your GP, primary physician, is a good first step if you're unsure who to see for an arthritis diagnosis. But when it comes to RA, rheumatoid arthritis, your medical doctor normally refer you to a specialist, and that specialist called rheumatologist. I'm not saying it very well, right? Rheumatology is a specialist that is mainly seeing rheumatoid arthritis specialist. For osteoarthritis, unfortunately, you don't see rheumatologists, right? So the diagnose, it comes to physical diagnose and lab test diagnose. Okay, so what are the physical diagnose? First thing, your practitioner, or if you're an acupuncturist, physiotherapy, osteopath, you know, chiropractor, medical doctor, you need to know the physical diagnosis. If you're a patient of mine on Szenan-Balance page, then you know this is how we diagnose, no matter who you go to. Okay, physical diagnose, physical examination, not diagnose. Physical examination is the first thing that we run, right? So looking the joint, looking for swelling and redness. If the joint pain over here, we're gonna have a look. Is it swelling? How do you tell swelling? You compare with this joint to the others, right? This is how you compare with it. Right? You compare with it. So mostly, if we bend, we can see some crease or wrinkle things around the joint. If that disappear, and we know that this is swelling, especially in your knee, you know, if you straight your knee, you can see that there's some crease over here. When it's swelling, those crease disappear, or crease getting less, and that we can tell this is a swelling, right? So you always compare to the normal side, right? So looking for swelling and wetness. Redness is simple, right? It's just it's red and the other side is normal color. Then you know it's redness. And you use your hand to touch the joint. Why do you use your hand to touch the joint? Because if it's inflammation, it may cause heat. So touch that joint and the other, and to find which side is warmer or hotter. So don't just touch here and here, because you want to know that what's the temperature below it and above it. What if both sides temperature the same? You know, you gotta touch. That's how I normally do it. I touch here and touch down there. Oh, okay, pretty similar in here. But touch here, here. Oh, here it's cold. Here it's cold. That's very hot. So that warmer than there, as well as warmer than the opposite side. This is how I do it. Give it a little pressure. When you touch it, give it pressure. Why give it pressure? You want to find out where the area is painful. Whether it's just in here, here, or here, or all around, okay? Especially when it comes to acupuncture, we use meridian. We do, well, balance method acupuncture is very, very good, effective for pain relief, right? So we want to know where the pain area is. The patient will show you, oh, pain's over here, here, but pain may be in here too, but the patient didn't realize it. Why is that? Because pain over here and here are much worse than here, and the patient just feel pain over here and here, but actually pain over here as well. So normally, it's quite often if patients say pain here, here, and a stick needle, and oh, the pain's gone, and the patient say, oh, the pain switched to the back side of my knee. That's not switching to the back side. It's because we use needle on the distal area, target the pain over here, target the meridian over here, and the meridian over here, the blood flows better, and the pain's gone, and patient now feel pain over here. So use your hand, go around and touch it to find which one is more tenderness, which way are the tenderness spot. You know, what are the area that is actually painful. Some pain you feel it without touching, but some you have to touch it to be able to know where is the pain, right? So you touch it around, or you find, okay, here is bladder meridian. This is in Chinese medicine, acupuncture diagnose. Bladder meridian, oh, painful over here too. GB meridian, oh, painful over here too. Stomach meridian, okay, nothing in here. Oh, painful over here. Kidney meridian, that's it. That is the acupuncture meridian diagnose. So we're talking about physical examination. So physical examination in Chinese medicine, when you do acupuncture, you need to do that too. All right, you need to do that. We do that too. Okay. Okay. Now then we test the range of movement. So get it to bend. Okay, and we can't bend outside and inside, right? But you have to let the patient lay down and go push it, and the joint go to side to side, and see whether that's painful too, or not just bending. All right, if that is just talking about the knee, but different joint, different range of movement testing, examination. Okay, but with the touching, find a tenderness spot, you know, every joint is the same. You just go around and palpitate it. Right. Then testing the reflexes and muscle strength. So restrict, like ask patient to hold this, and you push, and ask patient to against it. So this is testing the muscle strength. Or if it's hand, ask your patient to hold it tight, and both sides you have to compare both sides too. Okay, otherwise you don't know how the strength is on one side. Okay, so always compare both sides. Same as range of movement, and you're touching palpitation, palpitate the area, range of movement, palpitate the area, and checking the strength. Okay, always compare the good side. All right, this is the and so, no matter whether it's RA or OA, okay, you always goes for physical examination first. Range of movement, swelling, pain, tenderness, spot, and the muscle strength. All right, this is the physical examination. Let's keep going. Now, for RA and OA are the same. Okay, let's talk about OA. All right, in OA, we know OA is often a slow developing disease. Right, we all know this. Right, and it can be difficult to diagnose. Okay, the main part to diagnose this problem is actually we're using the X-ray or MRI. Right, so X-ray can see the bone. Right, then when you use MRI, you can really see the cartilage and the bone, how often, what is going on with them. Okay, if it's very early OA, it may be difficult to diagnose because they just have symptoms. With the symptom that we talk about, the physical examination, and a lot of things that can happen in the joint that causing pain and swelling and reduce the range of movement. So for OA, you really, if you want to diagnose this as osteoarthritis, we really rely on the X-ray and MRI. Okay, so the doctor may just refer you to that to get the test done. Now, when it comes to RA, and that's a whole different story. Okay, yes, you may still get MRI and X-ray. You know, it can show pretty similar, or it can be no much change in the test, in the X-ray and MRI. But to really diagnose RA is not based on the X-ray and MRI. It's actually based on your blood test. In the blood test, okay, what are we looking for in the blood test? In the blood test, we are looking for rheumatoid factor. So rheumatoid factor test is we rely on this test, and not just here. We also need to run. If you can see the report, if your patient bring to you, it's called antibody test. Antibody test, there are few of them. So one of them called anti-CCP, and the other one is anti-nuclear antibody test. The anti-CCP, this is something that we want to know. And anti-nuclear antibody test, it can happen, it can be positive for any autoimmune disease. RA is autoimmune disease, right? So anti-nuclear antibody test, it can happen with other disease, not just RA. But with RA, we really want to see the rheumatoid factor test and anti-CCP. Okay. There are C-reactive protein tests as well, and ESR tests as well. So all these 5 different tests, that is something that we need to look at. Okay, but the main 2 is rheumatoid factor and anti-CCP. Those once we lock down those 2, we know, okay, this is rheumatoid arthritis. Simple, right? Simple. As I say, the symptom will be the same. Over here, or you can't tell whether it's OA or RA. You have to run. You have to run X-ray, MRI to see. Oh, there is wear and tear, because this is the degenerative disease. Okay, so this is all about in the Western medicines. Okay, you use this technology to test it. But think about it, acupuncturists, Chinese medicines, did we have all this tests before? No, we don't have it. So our diagnosis is different. When it comes to, yes, we have arthritis. The name of arthritis in Chinese medicines called 关节炎. Okay, and in the old time we call 痹症. B-I, 症. 症 is B symptom. What's B symptom? B symptom is swelling. What are the symptoms? The symptoms are swelling, including joint swelling, redness, less mobility of the joint, range of movement decrease, painful, stiffness. So those are the symptoms that same as Western medicine at the moment. Okay, all Western medicine symptoms the same as here. Okay, and it can be redness, and it can be fever, right? So all the symptom we call B symptom, 痹症 in Chinese medicine. Then how do we diagnose it? We know when it's 痹症, we don't give it OA or RA. In Chinese medicine, we don't care about this, because we have other point of perspective to look at this disease. The system is different when we look at it. We look at the whole body rather than just a joint. Why do I say that? Okay, we look at whether you have suffered from the imbalance, the dysfunction of your stomach and spleen, kidney bladder, liver, gallbladder. We need to find out whether there are any organ imbalance that causing the joint issues, the B symptoms. Okay. Then we talk about what causes in Chinese medicine. When it comes to B symptom, in the classic acupuncture book, in Chinese medicine book, we talk about wind, cold, dampness. The 3 things that causing it. So we will go and get an examination. Our examination is easy. We touch, we feel, same as Western medicines, and we find out which meridian. Oh, pain is over here. That is acupuncture meridian diagnosed. It's different with the Western doctor. They don't care about where exactly the pain is. They know, oh, pain is all around. It's in the knee. That's it. But we need to go down to, oh, pain is actually on the outside of the knee, not inside of the knee. Pain is actually in the front of the knee, not on the back of the knee. Right? In the front of the knee, that 2 meridian, which is stomach meridian and spleen meridian. So, because this diagnosis help us to treat it. So we come from different system, different background, different theory. So our diagnosis is different. Okay, our diagnosis are different because this diagnosis help us how to treat it. So when we treat arthritis, we want to, if our diagnosis is the organs imbalance, and how do you tell organs imbalance? Okay, I use pose. I use pose and tell which organs are out of balance. Now, if we don't use pose, can we still tell that it's because wind or because of the coldness, because of the dampness? Yes, we can. When it's wind, then it's more in wind, like wind, the wind and cold and dampness, right? Wind is wind pain, wind more than cold, more than dampness. When the wind more, you feel pain in here, and tomorrow you feel pain in here, and the next day you feel pain in here, and not normally stay in one joint. You feel the pain here, just like wind blow on it, and everything go around. This is the word diagnose. This is how we diagnose. We ask the question. Then, what about dampness or cold? Cold is on one joint. I'm on live video. Sorry.
But, okay.
My daughter. So, when it's on one joint, and you feel cold. When it's cold, you like warm sensation, and it's very sharp pain, and the pain is very sharp, and that's cold. And when the weather changes to cold, and the weather is colder, and you get more pain, and you like warm, and that is what we call cold. And the joint over there, whenever the pain in the joint, it is colder. Okay, it's cold, and you feel the cold. And patient, it's so cold. The joint over here is cold and painful. They can actually literally feel the coldness in the joint. Okay, there's another one. How about dampness? Dampness is you feel pain, but the pain is probably achy, but more like heaviness. You feel the joint is so heavy, So that's how we tell it's dampness. And you can see the tongue. If the tongue have thick coating, then we know it's dampness. And if the tongue is too big, a lot of teeth mark, we know this is spleen and stomach. Functions not good, and though through that, because of the spleen and stomach function, then it low and it produce a lot of dampness. It couldn't get the water out of the body. That's it. So this is the Chinese medicine diagnosis. So different. It's very, very different. Alright. With the Western medicine's diagnosis. So I'm not saying which one is right, which one is not right. It's just the different. But in Chinese medicine, we look at the Western medicine diagnosis. Then we use the test, like especially rheumatoid factor in the blood test. So we treat it. We diagnose, using Chinese medicine and acupuncture, and we treat it, then the patient feel better after months or year, or what, a year, 6 months, 3 months, 8 months, 9 months, maybe. So we ask the patient to get the pneumothorax factor test again to see whether the pneumothorax factor is running lower. The antibody test is running lower. Is it possible? Hi Hassan, how are you? So it's possible to reduce the blood test factor. Okay, so it's possible. Now again, when are we just saying using Chinese medicine and acupuncture to treat it completely? No. Change the lifestyle, control the emotional. Then we're going to talk about it tomorrow. And in Chinese medicine, we use the emotional energy to help us to diagnose which organs are out of balance. So apart from wind, cold, and dampness, we use anything, all the information to help us to determine which organs are out of balance. Like if it's kidney, the patient will what? They're scared all the time. There's fear in there. And we know, oh, this arthritis is actually linked to kidney function out of balance. They go to the toilet a lot, frequently for urine, because kidney control urine. So we use other symptoms to help us to diagnose, to get into which organs are out of balance. Now talking about Chinese medicine. Now the patient may feel what about spleen and stomach? Okay, the patient may feel constipation, bloating, diarrhea. Then we know the organs out of balance, the spleen and stomach. Just an example for you. And what about liver? Wow, the patient get angry, stressed a lot. Frustration. Hi, happy day, how are you? So all this to help us to diagnose by asking the question, asking all the organs, symptoms question to help us to determine which organ out of balance. Then we know how to treat it. So when we do balance method acupuncture, yes, we're going to talk about treatment tomorrow. Then when it comes to treatment, I can talk about how we do acupuncture for it. What strategy are the best for joint pains, for arthritis. Okay, so keep it, and this is how we diagnose Western medicine and Chinese medicine. Okay, in Chinese, you know that Chinese medicine and Western medicine two different systems, but we use Western medicine tests to prove that acupuncture and Chinese medicine is working. So how do we do that? So all the tests we run all the tests, blood tests and X-ray, blah blah blah, and physical examination. Then we put needle in. We use Chinese herbs for a while. Then we ask patient to do all these tests again. But unfortunately, the X-ray may not show any change. But the main thing is the physical examination. Swelling went down, redness go down, pains disappear, range of movement improve and back to normal. That is how we diagnose using according to examination. Then we treatment and we come back to examination again. So we call re-examination. Re-examination, everything's fine, that's good. But X-ray, mostly we don't get patient to get X-ray. Why is that? Because there's no need to. Patient don't want to spend the money for another X-ray because what they want really is no pain, able to move properly. That's it. okay, and it's wear and tear issues. An X-ray came out, the structure may be the same. Why is that? Because we talk about the cause of arthritis. It's not what you're seeing in the X-ray. Alright. Thank you for this information. Very nice. Thank you, Judith. So, treating arthritis, you test the X-ray, MRI. It's wear and tear issues. But sometimes it does change though. Why is that? You may see that the bone actually change a bit, especially when it comes to the joint on the finger joint. They cooked. They changed the joint. You know, the structure changed. The structure sometimes get back to normal, especially when it comes to swelling. When you go X-ray for swelling, and when the swelling reduces and you go for X-ray again and put the joint back to the normal. It can, but not 100%, not 100%. Especially for wear and tear, we are not using the X-ray to tell whether it's working or not. Okay, because what really patient wants is pain-free, able to do the work, normal duty, normal activities. Okay, but the rheumatoid arthritis blood test, it can really change it. It can change it. Okay, when the rheumatoid factor is very high, it can reduce it and it can disappear that, but not in the Western medicine. So we use the Chinese medicine and use acupuncture to bring the organs function better according to the Chinese medicine diagnose and examination. Then when the symptoms free, there is no symptom, we can simply ask patient to get a blood test and check the RA factor, right? And check the antibody blood test. It can change and it can become better. It can disappear too, right? So this is RA. This is RA. This is a bit different. So some tests, with RA, we won't get patient to get MRI again in X-ray because there's no point to get patient to do that. Okay, we ask patient to do a test with a purpose. So what is the purpose that you ask patient to do that? Okay, this is for today. We're gonna talk about what are the treatments. Okay, the treatment will include Western medicines. I'm not a Western doctor, but I graduate in Shanghai. I study Western medicines and Chinese medicines. So if I were in China, I can go ahead and be a Western doctor as well. So we have the knowledge. So I study both Chinese medicine and Western medicine. But when I come to New Zealand, I'm from Malaysia. If I go back to Malaysia, I'm not allowed to practice Western medicines. I'm only allowed to practice Chinese medicine. Because of the laws different, same as in New Zealand, I only allowed to practice Chinese medicines. But I can, I hold a bachelor of medicines, which means I can pass the test in here and go for 2 years of interims. That's what I heard about that. Then become a Western doctor, but I'm not interested in Western doctor the method because I really want to get my patient better rather than get my patient on the drugs forever, right? So I rather do the Chinese medicine. And another thing is in China we use Chinese to study Chinese medicine and Western medicine, and that is so difficult for me to take this test, the Western test. And I've seen my patient. One of them is from India, and he was a specialist in India, quite famous one, and a surgeon. But unfortunately, when he and his wife immigrate to here, and his wife actually passed the test over here because they practice over there, and the wife passed the test over here and become a GP, a general doctor, family doctor in here. But he couldn't do that. He didn't pass. He failed the test a few times. He gave up, you know. But he was a specialist in India. Think about it. So it's not easy to pass it. In India, they use all English to study, but in China, I was based on Chinese, and really, I don't have the confidence to pass the test. And really, I don't want to be a Western doctor anyway. Right. So, okay. That's all for today, and thank you for being here with me and supporting me in this live video, and I'll see you tomorrow. Stay awesome, and I love you all. Tomorrow, we're going to talk about the treatment for arthritis. Stay awesome. Bye-bye.